Hi, I'm Ruth, and I'm with Methodist Hospital, here to show you a little bit about how to do infant CPR if you ever need to. So our first step is going to be that we need to check for scene safety. We want to make sure that before we put our hands on somebody or we get too close, even for your infant, that it's safe for you to do so. So I'm looking, and it's safe for me to approach and touch this child. Okay? So then my second step is I'm going to grab that infant's ankle and I'm going to tap and shout, "Hey baby, are you okay?" I'm going to be looking for signs of responsiveness. They might turn from side to side, you might see their eyes flutter, they're going to make eye contact with you. Anything really is going to count as responsiveness. If they're not responding to you, if they're not saying, "Hey, you're touching me," we need to act. My next step is going to be to call for help. We might just have to shout out, "Help, somebody help me, I need help." If you don't have someone that responds to you, you don't have a phone nearby, you're gonna go ahead, call out for help and go ahead with your steps. We've already checked for responsiveness, we've already called for help. We're gonna take 5 to 10 seconds just looking at the abdomen, looking at the chest to see if we see the chest rise and fall. If you see the chest rise and fall, that's a sign that that child is breathing. We're gonna stop where we are. We already have somebody calling 911 and we're still gonna get help, but we would stop there. If the child is not breathing or they're not breathing normally, we see agonal gas, we see retractions where the abdomen sinks in, we're going to have to start CPR. So with CPR, we're going to take 2 fingers and we're going to come to the middle of the chest, right across the underarm line here, just slightly below it on the middle of the sternum. Okay, we're going to put those 2 fingers there. We're going to go down about 1.5 inches and allow the chest to rise completely. Okay, that's pretty deep. Don't be scared about breaking ribs or hurting the child. If they're not breathing, not responsive, they're not doing too well. So we are going to prioritize making sure that we push blood throughout their body, especially to their brain. We're going to push hard and fast 30 times in a row. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. After we've done 30 compressions, we're going to go ahead and open up the airway and give 2 quick rescue breaths. So for an infant, we're going to put our hand on the forehead, 2 fingers are going to go under the bony part of the jaw. The hand on the forehead is going to help guide the head back. 2 fingers on the jaw are actually going to bring the jaw forward, bringing the tongue off of the back of the airway for the best open airway. We're going to go ahead and put our mouth over the nose and mouth of this infant, so that we're going to blow in through their whole airway. And 2. When I give rescue breaths, I'm looking to see that the chest rises. If I don't see the chest rise, I would stop, reposition the airway, and try one more time. You're going to continue to do sets of 30 compressions and 2 breaths, 30 compressions and 2 breaths. Continue that cycle until either help comes and takes over for you, or the child becomes responsive or starts to breathe on their own. For adults, we teach hands-only CPR. They want you to call for help right away, and then they want you to put your hands in the middle of the chest and push hard and fast until help takes over. For adults, often it's that something is going on with their heart, and if we can get the heart pumping, we can help sustain them. For infants and also for children under the age of 12, we are looking at situations often where they aren't breathing. Something's gone on and there's a larger systemic issue that has caused them to become unresponsive and to stop breathing. So we want to go ahead and offer both the compressions and to give them rescue breaths. Here at Methodist, we currently offer 2 open CPR classes every week here in the Children's Tower Atrium. You will see times posted throughout the hospital. We also offer a more in-depth CPR course through our Methodist Women's Center. We want to make sure that you're prepared to help any child who is not responsive and not breathing. You can make a difference in a family's life.